Maintaining our bodies is a lot of work. We spend so much time on skincare, our morning and nighttime routines, going to the gym, going to the doctor, having a good diet. There's so many things to keep track of. So do we really have time to get our cleanings every 6 months? Why not push it off to every year or even longer? If you're asking this question, you probably have pretty good teeth. At least I hope so, because I don't know why else you'd be asking it. You're probably so used to hearing that you do a great job at home, you have really healthy teeth and gums, and you just have no cavities. And if this doesn't sound like you, let's just say it is. You're taking really good care of your teeth, there's no sign of gum disease, you're brushing and flossing really well every single day. How often do you really need to get a dental cleaning? I would still say every 6 months. Now I know you're probably looking at me like, dude, this guy's a dentist. I mean, of course he's gonna say every 6 months. I mean, he's trying to rob me. The reason you still need your cleaning every 6 months is that there are certain things that can only be cleaned away at the dentist's office. Even if you take really good care of your teeth, there are certain things that you won't be able to clean away. This is called tartar. When you brush and floss, you're cleaning away plaque. Plaque is basically these clusters of bacteria that have loosely attached themselves to your teeth. This is easily cleaned away with your toothbrush and with floss. But over time, plaque will start mixing in with your saliva, and it'll start getting mineralized from the minerals in your saliva, and it'll start getting harder. And when this happens, it gets really stuck to your teeth. And now you can no longer remove it with just a toothbrush and floss. You need special tools and a trained professional to remove this, and this is why your dental hygienist will remove it every 6 months. If this tartar is left alone, it'll continue to build up, and as it does so, it'll cause more and more inflammation around your gums. And this is one way you end up with gum disease. Now this is not an overnight thing. Obviously it takes time for this plaque to build up, to turn into tartar and start actually causing inflammation. And some people will build it up faster than others. But if you keep pushing it off, there's a chance that this gum disease can keep getting worse, and that tartar can now spread underneath your gums. Now you're looking at periodontal disease. When this happens, you have more inflammation, and now the inflammation is getting around your bones, so now you're looking at bone loss, and over time your teeth can get more loose and potentially even fall out. Now again, this doesn't happen overnight, and some people take a lot longer to get to this point than others. But there's no point in waiting to get gum disease, especially now that we know that gum disease is linked with problems with the rest of your body. Gum disease means that bacteria in your mouth are getting into your bloodstream. And studies have shown that periodontal disease has made people more likely to get heart disease, gastrointestinal diseases, diabetes, Alzheimer's, and other problems. So now you're starting to see that it's more than just your mouth. And if you want to maintain your body and keep it healthy, your oral hygiene cannot be skipped. Now, once in a while, I do see people who can push off their cleanings to every year or so if they really don't want to come in, but it's better just to not risk it. There's no harm in getting your teeth cleaned. And it's not just a cleaning you get when you come. You also get a dental exam. And this is where we check for any signs of oral cancer, any cavities, any infections, anything wrong with your gums, or just anything in general wrong with your mouth. Thank you guys for watching. I hope you liked that video. If you haven't already, please hit the thumbs up button and subscribe to my channel below. I'll see you in the next video.